Dr. Wesley Boyd, thank you so much for joining us on Psytalkz. Well, it's truly a pleasure to have the opportunity to discuss such an essential and profound topic as ethics with you today. But I'm looking forward to hearing your insights on why ethical principles are so crucial, where students should begin to learn about them, and how modern technologies are shaping our understanding of ethics. And I would also love to hear your thoughts on the key principles and philosophies that can guide students when they face ethical challenges in their careers. To start, I would like to ask, why are ethical principles so important in psychology?
Well, ethical principles are, in my opinion, important for one's everyday living across the board. And obviously, therefore, they're also quite important in psychology. I would say they're actually perhaps especially important in psychology because so many of the patients that we're going to work with, so clients, are often having very difficult times. That's the reason they come to us in the first place as patients. And often we're seeing people at their most vulnerable points, the most vulnerable points in their lives. And so given that they're frequently coming to us in pain, suffering perhaps as much as they ever have, and they're quite vulnerable, we need to really be very mindful of not in any way, shape, or form taking advantage of that and really keeping their health and well-being first and foremost. And so, the basic ethical principles, such as beneficence, which is, promoting good and doing good, and non-maleficence, namely preventing harm or not doing harmful things, are vitally important when you're working with people in a psychological or psychiatric context.
In human-centered professions like psychology and psychiatry, ethical decisions often lack clear boundaries. So, as a result, they sometimes find themselves making, for example, emotionally driven choices. So, how can we balance emotions, logic, and professional guidance when making ethical decisions?
Those are great questions. There are, as you alluded to, many issues where ethically you could argue one way or the other, right? And there may not be a single right answer, but there are times when there are absolutely, right answers and correct ways of proceeding. For example, no matter what, I should never take advantage of a patient. No matter what, it's always ethically wrong for me to engage in romantic relationships with patients, for example. On the other hand, there are a lot of ethical issues where the boundaries are not so absolutely clear. For example, if I'm meeting with a patient, how much should I reveal about myself? Individual practitioners will have different boundaries about what they will or will not say about themselves to patients. Some will offer almost no personal details whatsoever, and others will offer a little more. My feeling is if people ask questions about me that are probably readily available about me on the internet anyway, I'm certainly going to answer those. But if they ask me any questions of an intimate nature or something like that, of course I wouldn't. So the question you asked about how to balance emotions with ethical principles, I think the key for me is always if I feel like a given issue is emotionally pressing for me or something that is very, hot for me, namely it's something I'm dealing with in the moment, that's absolutely the last thing I would ever share with the patient. Right? If I'm saying anything to a patient, I want to make sure it is for their benefit and not because it's something that I feel like I need to get off my chest. Right? And so I might have very strong emotions sitting with a patient and sitting across from a patient, but I'm going to really try to keep in mind that anything that comes out of my mouth or any action that I take is for the benefit of the patient.
Thank you for your answer, Dr. Boyd. Well, modern technologies, particularly artificial intelligence are becoming increasingly prominent in the field of psychology. So, how do these advancements influence ethics in practice?
Question is so good and so broad. I'm not sure I have a real good answer, but the reality, as you know, and anyone watching this knows, is that AI, or artificial intelligence, is here to stay. There's no sort of putting that genie back in the bottle or pretending it's not here. We need to embrace the fact that it's here and use it. And in fact, I was part of a conference recently at Harvard Medical School, sponsored by the Center for Bioethics where I work. And we had a 2-day-long conference where we were discussing the use of AI in medicine. And we came to the conclusion that many experts in the field, and I don't consider myself one of them, but we came to the conclusion that it is actually a moral imperative to embrace AI and employ it to whatever extent possible. And because the promise of AI is so dramatically large that it could really push forward our ability to render accurate diagnoses, to offer better prognoses to patients about their particular illnesses, and then also devise treatments to help them. So I feel like we have a moral imperative to embrace AI and to use it as one tool among others that can help us take the best care of patients possible.
Thank you. And my last question is that I think it is essential for psychology students to be equipped to handle ethical dilemmas and develop a framework to address them effectively. So this not only ensures individual accountability, but also contributes to the professional integrity of the field on a societal level. So in this context, what are the fundamental ethical principles students should adhere to? I mean, how can these principles be emphasized during their preparation for the profession?
There are several medical ethical principles at this point that are more or less etched in stone. A couple of American authors, Tom Beecham and Jim Childress, have a book called The Principles of Biomedical Ethics, which is now, I think, in its 8th edition. It's been around for about 50 years, plus or minus. And the principles that they put forward are, as I said, more or less etched in stone. And I've already alluded to a couple of them in a previous answer, but the 4 basic principles are autonomy is the first one. And what that means is allowing people to make choices for themselves and respecting their ability to choose for themselves, assuming that they have rational capabilities and they're able to think clearly. And so, for example, no matter how vulnerable patients are, I think respecting their ability to make choices for themselves is fundamentally important. And you'd really, unless someone is not able to think rationally or clearly, if they have a dementing illness or, some other reason that they're not able to use their rational faculties, we really need to respect autonomy, their ability to make choices for themselves. The next 2 principles are, as I already said, beneficence and non-maleficence, and those are really flip sides of the same coin, right? Doing good, trying to promote good, while at the same time trying to prevent harms. It's important for psychologists to know that any treatment they offer, even psychotherapy, just using words, if it has the ability to help someone, it can also potentially hurt somebody. I mean, I literally will never forget, and it was probably 25 years ago at this point. I had a patient who I was seeing every other week, and she came in 2 weeks after our last meeting, and she said, "I've been crying ever since we met 2 weeks ago." And I was astounded. I said, "What are you talking about?" She said, "Well, that thing you said when we were meeting just cut me to the core." And I had no idea that I had said anything that was damaging. I couldn't remember the particular thing that she referred to. But my point here is that anything that can potentially help you can also potentially hurt you. And you really need to weigh that very, very carefully when you're administering any kind of treatment to a patient whatsoever. The last principle, so there are 4 principles: autonomy, beneficence, non-maleficence. The last principle is justice. And justice is really thinking about distributing goods and services in a fair and equitable way across a society at a societal level. And so, if in a country like the United States, where everyone does not have health insurance, which is just a travesty, I can't believe I have to say that, but that's the reality here in this country. There are a lot of people who have perfect access to healthcare, and then many, many others who don't have access at all, which I consider a tremendous injustice. And so when something like that occurs, I feel like anyone who is interested in ethics or government or political science or philosophy or anything like that really ought to be advocating for increasing access to healthcare. And that's really a function of respecting the last principle, namely justice.
Dr. Boyd, thank you so much for sharing your valuable insights and expertise with us today. And as we conclude, I would like to express my deepest gratitude for your time and wisdom. Well, this conversation has shed light on the critical role that ethics plays in psychology, not only as a guiding framework for practitioners, but also as a foundation for trust and accountability within the field. So, thank you again for joining us on Psytalkz. We hope to have the pleasure of speaking with you again in the future. So, take care. Goodbye.
Thank you so much. It's my pleasure being here. Thank you for having me.